Cervical cancer, what is it? What are the causes? What are the signs and symptoms? And how well can we prevent it? These and many more we'll be discussing today. So hello guys, welcome to Trendy Health Talk with Nurse Aji. This is our first video of the year, so I say happy new year to you all, and I wish you guys a year filled with joy, happiness, blessings, all true. So this year's slogan is no grief for anyone. So they're not grieving for anyone, no grief for sickness as well. Yes, this year we are staying healthy. So that leads us to our discussion. Cervical cancer. Cervical cancer is a common female cancer. Initially occur at the cell of the cervix, that is at the lower part of the uterus, and yearly we record 600,000 of people being affected, and out of that 600,000, 340,000 deaths yearly. So it's not a joke. Who are those at risk? Women. And we have women of certain ages, and number one is women in their teens and 20s, and the other one is women in their middle age, that is those in their 30s and 50s. Though people that are women that are above 50, can still have it. Yes. So what are the causes? What is the main cause? The main cause of cervical cancer is human papilloma virus, HPV, human papilloma virus, and this particular virus is a sexually transmitted infection. So it leads to changes in the cervix, which will in turn lead to cancer. So what are the risk factors? Number one is weakened immune system. If you're the type with a compromised immune system like those with HIV, then they already, their immune system is already compromised, so they are at risk. And another one too is smoking. Women that smokes, smoking actually increases your chances of developing all types of cancer. But then those that smoking also, it weakens your immune system, so making it harder for you to be able to fight infection. And number three is early sexual activities. Women that start having sex at the tender age, apart from those that are being raped, we have women that start having sex at age 10, 11, 9, And also number four is multiple sexual partners. That also is a risk factor if you have multiple sexual partners or your partner have partners. So it's also a risk factor. And another one is number five is family history. If anyone in your family have suffered this particular cancer, then it increases your risk. And number six, lack of regular screening. If you don't go for screening, check whether you have it or not, then it increases your risk. And number seven is poor socioeconomic factor. Probably you live in an environment where you cannot access healthcare, so it also increases your chances. Signs and symptoms. Number one is abnormal vaginal bleeding, which could be bleeding between periods, bleeding after having sex, or bleeding after menopause. And number two is vaginal discharge, which can be watery, smelly, or bloody. And number three is pain in the pelvic. That pain could occur after sex or during sex. And number five is pain at the lower back. When you discover that you are having pain at your lower back, then it's also a symptoms, though it could be a sign for another thing entirely, but that's why we say you go to the hospital to actually know what is wrong. And last but not the least is persistent fatigue. Loss of weight and appetite. When you notice these three, then you should go to the hospital. So now, how do we prevent this cancer? Number one is to make sure that we get vaccinated. All thanks to God, there is vaccine for this cervical cancer. So, and it is more effective when you get vaccinated before you become sexually active. Yeah, so especially let's get our girls vaccinated against this particular cancer. And number 2 is regular screening. Let's endeavor to go for screening whether you are at risk or not. Let's go for screening for early detection, because it is very preventable when it is discovered early. So let's endeavor to go for screening for early detection. And number 3, practice safe sex. Very important. Practice safe sex, because it is solely transmitted through sex. Okay, so practice safe sex. Make sure you use condom. Make sure you are faithful to one faithful partners. So make sure your partner does not have partners. So to be on the safer side, make use of condom. Yeah. Number 4, if you smoke, quit smoking. Smoking does you no good, so quit smoking. Yeah. And number 5, adopt a healthy lifestyle. Very important. Endeavor to maintain a healthy diet, healthy weight, and all of that. So this year we no dey gree for any disease whatsoever. So let's keep up with our health, and I'm definitely gonna see you guys in my next. So until then, bye.